right, so we'll get started. And so this video I'm doing tonight is for my new nurses or my soon-to-be new nurses. If you're in your last semester of nursing school, I know how stressful and exciting that could be at the same time. So I just felt led to put together this video of some helpful tips for new nurses, because I was once that new nurse. So, and over the years and being in nursing, I've been in nursing almost 10 years now. I graduated from nursing school in 2000 and the beginning of 2010. So we're approaching 2020 in a couple of months. So I will have been in nursing for a total of 10 years almost. So for those of you who don't know me or not familiar with me, I am Dr. Jessica Chung. I am a doctor of nursing practice and a family nurse practitioner. I currently practice primary care in Florida, and I also do teach adjunct at a university. And I have taught undergrad and graduate nursing. So it's all I know as far as my career is nursing. So I hope I know a little bit. So all right, we will get into the tips that I felt led to put together. And then please, if you want, you can always post questions, or you can put in comments as I'm speaking. And at the end, I will open it up for any comments or questions. All right, so the first tip I wanted to share for the new nurses or the soon-to-be new nurses, or if you're thinking about going back to nursing school. First tip I want to share is that you can obtain employment right out of nursing school and in the area of nursing you prefer. So a lot of times, and this goes for many other professions, people feel like, oh, it's going to take months to get a job because you don't have the experience in that area. You know, it's competitive out there, and you feel like, you know, you're just going to have to wait months and months before you can actually get that position that you want as a new nurse. Well, I'm here to tell you that's not the truth. You can be in your last semester of nursing school. You could be waiting to take your NCLEX and have job offers waiting for you. There are large companies, particularly hospitals, that will actually hire you before you even pass your NCLEX. So don't feel like that the job process has to be this long, drawn-out process before you can work as a new nurse. It really isn't. I want to say that I was working as a nurse. After I passed the NCLEX, it didn't take very long for me to get a job. Nursing is in high demand. So don't let that deter you or make you feel discouraged in any way that you cannot get employment right out of nursing school, because you can. So a part of that tip number one, I just want to add, apply for nurse residency and graduate nurse programs. Those programs are usually offered in hospitals. So you want to apply for those nurse residency or graduate nurse programs. So those programs will help you usually get that experience that you need as a new nurse. And as I mentioned before, a lot of times they will hire you prior to you even passing your NCLEX exam. They at least want to know that you have the SIT pass. I think it's still called SIT pass. So as long as you still have the SIT pass, they're willing to hire you. I know where I live, there's a large hospital here that hires new nurses right out of nursing school, as long as they have that SIT pass. And they typically accept nurses up to 1 year after graduation. So those graduate nurse programs are really good for the new nurses. So if you can get into those nurse residency or those graduate nurse programs, that will be awesome to gain that experience and learn, you know, what you need to learn as a new nurse. So in addition to tip number one, I want to add, you don't have to start your career on med-surg. A lot of times, and I've heard it even myself, that you should go into med-surg because that's where you'll get all your experience. And excuse me, for those who don't know what I'm talking about, med-surg is medical surgical. That's the medical surgical unit. That's typically the unit that takes all the patients with whatever they may have going on. If they're not critical, they usually go on a medical surgical unit. There is no written rule that you have to start your nursing career on a med-surg unit. So if you want to start in labor and delivery, if you want to start in the emergency room, if you want to start in perioperative, it may be more challenging as a new nurse to get your foot in the door in a more specialty nursing area, but it's not impossible. So if you really want to work in a specific unit, you can definitely, you know, go into that unit. And, you know, sometimes it takes networking and getting to know people. Sometimes you might have to stay on med surg for maybe 3 to 6 months before you can go into another unit, but you don't have to go into med surg as a new nurse and stay there. You don't have to stay there 5 years before you can move on to another type of unit and what you really want to do. However, keep in mind that if you do want to further your career or your education as a new nurse, or into the advanced practice role, such as a nurse practitioner or a CRNA, you should have that well-rounded experience in every area. So it's okay to specialize in a particular area of nursing, but keep in mind that you want to gain that experience in every area that you can. So my personal story is I did start my career in actually long-term care in a nursing home. And then I went into nurse case management. So I didn't start my nursing career in your typical hospital setting. I didn't go into the hospital probably until after almost a year after I graduated from nursing school. So there's no written rule that you have to start your nursing career on med-surg. All right. So tip number 2, gain as much hands-on experience as possible. I can't stress that enough. I was that nurse that if they wanted somebody, if they were short in the ER, I was the one that went to the ER. If they were short in labor and delivery, I volunteered myself to go to labor and delivery. If they were short in the ICU, I volunteered myself to go to the ICU. So gain as much hands-on experience as possible. Pick up an extra shift if you can. Volunteer to float to other units. And then outside of your normal work area and your work environment, you could do things like participate in your community health events. So not only does that allow you to gain experience as a new nurse, but it looks great on your resume. So don't be afraid to venture out and try different things as a new nurse. Your nursing career is as far as you are willing to take it. So there's so much out there for you to do, especially in the nursing field, that don't feel like you have to put yourself in this box. So please, please, please get as much hands-on experience as a new nurse. That's where you can see everything and learn those things. Learn from, you know, the more experienced nurses, learn, you know, different things and techniques, and go to classes, go to CEU events, and you can probably look up a lot of free CEUs that you can go to as a nurse. And I'll talk about that a little bit. So tip number 2, gain as much hands-on experience as possible. Tip number 3, this might be a shocker for some new nurses, but don't be afraid. Tip number 3 is precept a nursing student. And you're probably thinking, how in the world am I going to precept someone if I'm new, as a new nurse? So why not? The only thing that can happen is that you and that nursing student can both learn together, and it allows you to gain leadership experience. So usually, if working in a hospital, nursing schools send students to the hospital, and they usually pair them up with other nurses. Volunteer yourself to precept the nurse. Why not? Precept the nursing student. That way, that student's learning, you're learning, you both are learning together, and that way, you know, you gain that leadership experience. All right, so that's tip number 3. All right, tip number 4, I mentioned it just briefly, but this is more like a tip, a helpful tip, and hopefully you'll learn this as you grow as a nurse, and these little things that they don't necessarily teach you in nursing school. So tip number 4, gain your continuing education hours way before it's time to renew your license. Just from my experience, you typically in the state of Florida, you have to renew your license every 2 years. And usually around that time of the year, that's when a lot of nurses are like rushing to get hours, and they're trying to find a conference, and they're trying to find all these different events, and they're trying to do these CEUs online. So just do yourself a favor, gain your CEU hours way before it's time to renew your license. In addition to that, keep your certifications up to date. I can't tell you how important that is. Your BLS, your ACLS, your PALS, that's your Pediatric Advanced Life Support, keep it up to date. It saves you time and it saves you money, because if your manager finds out that you're working without a current certification, they take you off the schedule, and then you can't make any money. You can't work until you get it renewed. So keep your CEUs up to date, keep your certifications up to date. Those are things then they're not going to teach you in nursing school. So those are things you find out along the way. Find out if your employer will reimburse you for continuing education hours and certification renewals. So some employers will reimburse you for renewing your license. They'll reimburse you for certification hours and things like that. All right. And so tip number 5, I will get into. All right, look outside of the hospitals for employment. And I mentioned that I didn't have your typical hospital job when I graduated from nursing school. So look outside of the hospitals for employment. So you might look into home care, case management, outpatient clinics, urgent care, administration. It's okay if you are working in a nursing area that's not necessarily in the hospital. Again, there's no rule that says if you're a new nurse that you have to work in the hospital. Yes, you gain your experience there. Yes, you can always, work PRN as needed, and you can gain that experience, maybe pick up a shift once a week on the weekend. But if you're looking for full-time employment, and maybe your city or your state is saturated as far as nurses, look outside of the hospitals for employment. Don't be afraid to look into home care, case management, nurse case management, your outpatient clinics, the prisons. There's a lot of places outside of the hospital that hire nurses. Look into pharmaceutical companies. They always want nurses because nurses have that education to do patient teaching. So there's a lot of opportunities out there for nursing. So don't feel like you're, again, stuck in the box of having to work in the hospital. All right. And so tip number 6, again, these are just some things that they don't necessarily teach anyone in nursing school. So I'm very practical. Tip number 6, look into loan forgiveness programs for nurses. Sometimes if you work in a certain area or a facility, usually it's like low income areas or urban areas. And if you work there, if you give them 2 years, or usually it says like if you give them 2 years of service, they can actually, you can be eligible for loan forgiveness. So, and basically that means they're paying back, they're paying a percentage of your student loans for you. Take advantage of that. Go online. There is websites. There's the government websites, the .gov websites. You'll have to just do a search for nurse loan forgiveness and take advantage of that. If you find a great job somewhere and that your employer, or you sign up for one of these programs, you get loan forgiveness, take advantage of that, knock off some of those student loans, keep some money in your pocket. You don't have to repay a percentage of that. And also look into your grants. If you have not grants, certain loans. If you work 1 year, for every year you work for an employer, some loan companies will actually take a percentage off of what you owe. So look into loan forgiveness programs in your work area. Tip number 7, again, practical tips that they will not teach you in nursing school. Don't be intimidated by experienced or older nurses. And I say this because sometimes, and a lot of times, you will feel this as a new nurse. You will go on a new unit and a workplace, and everyone appears to know what they're doing. And especially if you're being orientated with, you're doing orientation with a new nurse, and they're moving fast, and you feel like you're moving slow. You're trying to catch up. You're trying to understand what you're supposed to do, and you feel like you're not getting it. That may be true. You may not be getting it, but don't feel intimidated. Don't feel any less like you didn't do well in nursing school because you can't keep up with the more experienced nurses. You gain experience as time goes on. So there's an old saying that nurses eat their young, but I don't support that saying. There is, however, in the professional setting, there will always be a sense of competition and inferiority, especially when you're a new nurse. So I was that young new nurse out of nursing school, like 22, 23, and I was always the one working with the more experienced nurses, and they've been working for 10 plus years, and you're trying to learn everything you want to learn. You don't want to look slow. You don't want to look like, how did you graduate nursing school? Just take your time. It's a learning experience. You don't have to try to rush through anything. Don't feel intimidated. Don't be embarrassed if you make a mistake. Always, find a way to learn more and do better. But don't feel it like you have to be at a certain level by a certain period of time. Everyone has their own pace that they work at and that they learn. Just because you're a new nurse, just because you are a new nurse or the new nurse, it doesn't mean it doesn't mean you don't have a voice. So if you have a concern, maybe they paired you up with a nurse that maybe you two don't mesh very well. Maybe she's not or he's not the preceptor that you should have as a new nurse. Tell your nursing manager. That's okay. Just because you're a new nurse doesn't mean you don't have a voice. There's a way to stand your ground and also be humble. So speak up for yourself. It's your career. It's your license. Don't feel like you have to rush through anything. Tip number 8, find a mentor. This is very important. Find a mentor. And it'd be great to have a mentor in nursing. Find someone who's a nurse that can mentor you. They could be a nurse. They could be a nurse practitioner. Find someone in that area that can mentor you. And there's a lot of nurse mentorship programs out there. Again, you just have to do a search. Look for nurse mentorship. They may not be in your city or your state. You may have to do like video calls or phone calls. I do mentor. I have a mentee that lives out in Indiana, and we do calls every couple of weeks. So find a nurse mentor. Find a mentor also outside of the nursing field. Someone who can just generally mentor you, whether it be life, career, finances, relationships, just someone that you can talk to. And maybe they don't necessarily know anything about nursing, but they can just help you with professional goals and career goals and financial goals. So find a mentor. That's very important as a new nurse, and that's important in anyone that's new in any professional setting or professional area, whether you're just graduating from college, is having a mentor. So I can't stress that enough. Find a mentor. And I will also add with that, join a nurse mentorship program, which I mentioned. And a lot of those you can find online. There's typically there's not a cost, and they will pair you up with a more experienced nurse who can help you get through, everything that you feel stressed out about. And, it's very challenging as a new nurse. because there's so much involved in nursing and in medical and health. And when you're taking care of other people, you have to be on your P's and Q's. You have to know what you're doing, and you have to be confident, because you can go into a patient's room and that patient doesn't feel you're confident or competent even enough to take care of them. They don't feel comfortable. So no matter how scared you are, or no matter what you're feeling, you have to be confident, knowing that, okay, I went to nursing school, I passed the NCLEX, I am more than capable than taking care of someone. So be confident in yourself as a new nurse. Don't feel intimidated. It's okay if you're afraid or scared, but don't be timid and try to back away from new challenges or taking on new challenges as a new nurse. You will run into some things that were not in the textbook, and it's okay to ask questions. I'll just add this on as another tip. It's okay to ask questions. It's okay to look things up. You can be on the unit. It's okay to look things up. It's okay to ask another nurse. It's okay. It's definitely okay to question the provider. It's okay to question the physician, the nurse practitioner, or the PA who's in charge of that patient's care. If you feel that there's an order just doesn't sound right, doesn't seem right, it doesn't make sense to you, it's okay to call the provider and clarify the order. So I can't stress that enough as a new nurse. Don't feel intimidated by by experienced nurses. Don't feel intimidated by providers. Be confident, stand your ground, but be humble at the same time. So those are just some of the helpful tips I have for my new nurses. And so now I will just open up. If anyone has any questions for me, I see a few people have joined, but if anyone has any questions, please let me know what questions you have. Anyone have any questions? Even if you're not a new nurse, if you're an experienced nurse, that's okay if you have any questions for me. All right. Well, once again, I will just ask if you please like this video, whether you're on Facebook, Instagram, send me a heart, a like. Please share it with anyone you think that would find it helpful. Also, if you have any specific video tips that you would like me to do, please let me know. You can tell me in the comments, or you can message me. You can email me, hello@drjessicachung.com. But please let me know. Of course, you can also message me if you have any questions. Maybe you didn't want to put it in the comments. You can message me on Instagram or on Facebook. But those are my helpful tips for my new nurses. So hopefully it helps someone. And of course, I just want to say thank you all for joining. And I will be back in a couple of weeks. Again, we'll do another live. And that's all. Thank you.